rabbit hemorrhagic disease virus, and European brown hair syndrome. So the occurrence is worldwide. It was first detected in China. In Australia, it was used as a biological weapon to thin the wild rabbit population, and it was used in contaminated carrots. For the etiology of the disease, it's a part of the lagomorph virus genus, which is a part of Calliciviridae. The first viral strain is rabbit hemorrhagic disease virus 1 and 1A. They have a high mortality and affect European rabbits. Clinical signs are found in animals older than 2 months old. Younger animals, there's a subclinical infection. In rabbit hemorrhagic disease virus 2, it affects both European rabbits and the European brown hare. They're both susceptible. The clinical signs are seen around day 15 and day 20. It is less severe than rabbit and hemorrhagic disease virus 1 and 1A. There is no cross-reactions or immunity between the two virus strains. In European brown hair syndrome, it's similar to rabbit hemorrhagic disease virus, but it's a different disease and it only affects European brown hares. It affects older animals and young animals are okay. The rabbit hemorrhagic disease virus has different virulence variants. Only some show respiratory symptoms. For the epidemiology of the disease, the virus is shed in discharges, so nasal, saliva, and semen. The infection can enter the body orally, or it can be inhaled, or through the conjunctival route. It is a very contagious virus. It has few virions, which means there's rapid progression. It is hard to isolate in cell culture. It is very resistant. It can survive in the environment because it's non-enveloped. And the virus can cause a high mortality. For the pathogenesis of the disease, the virus enters the body orally, it can be inhaled, or the conjunctival route. The primary replication happens in the tonsils, and then a viremia occurs and it generalizes, and then a secondary replication happens in the liver, the blood vessels, and the airways. The liver has the most important clinical signs. The virus can cause necrosis and liver dystrophy. The virus can also cause vasculitis of blood vessels, which leads to hemorrhages, especially hemorrhages in the respiratory tract. For the clinical signs, there can be an up to 100% mortality. In a per-acute infection, there's sudden death within a few hours. In an acute infection, you can see bloody nasal discharge and central nervous system signs, such as seizures, tremors, and ataxia. This is due to the metabolites, due to the liver problems. And there can also be dyspnoea, because the lungs end up filling up with blood due to the hemorrhages, and it can cause death within 36 hours. There's a rapid progression. For the pathology, we can see hemorrhages everywhere, especially in the respiratory tract. In the liver, we can see dystrophy and it becomes pale. It's also enlarged and has necrotic areas. The kidney becomes really bloody due to all the hemorrhages. And the lung can become completely red because of hemorrhages. And there's also edema and emphysema. For the diagnosis, we can look at the epidemiology, the clinical signs, and the postmortem lesions, and the histopathology, such as looking at the liver dystrophy and necrosis. To detect the virus directly, we need to do a real-time PCR, and to detect the virus indirectly, we can do ELISA and viral neutralization. It's necessary to do all this because it's a notifiable disease. For prevention, follow the general epidemiological rules. If there's an outbreak, then carry out stamping out and have movement restrictions. And there's an inactivated vaccine for domesticated animals, and it's given around 4 to 5 weeks.